and coherent way so we can have a national approach to fixing this broken supply chain, to fixing the empty storerooms, and to putting these critical supplies and equipment on the front line. And I was so pleased that he invoked those authorities 5 days ago. But instead of using them, he's equivocating. He said things like, we have the act to use in case we need it, the president said, but we have so many things being made right now by so many. He didn't finish the sentence, but he meant in this voluntary effort, which I deeply appreciate, by the way, don't get me wrong. Every single mask and every single gown and every single shield that can be manufactured, and every single respirator that can be manufactured or lent to the people on the front lines, that's important. But it's not going to solve this crisis. It's not going to keep us in a position where we can actually flatten the curve. He said yesterday, we're a country not based on nationalizing our businesses. Call a person over in Venezuela, ask them, how did nationalization for their businesses work out? As every senator here knows, the Defense Production Act doesn't nationalize businesses. It is our tool. It is a mechanism to create a coherent strategy for our public sector and our private sector to produce goods based on an urgent national need. And the government pays market value for those goods and has a strategy for how those goods will be distributed around the country as the epidemic moves from place to place. It is unacceptable that we're in a situation where states are having to bid against each other, where the hospitals in Colorado are having to bid against each other. They said to me tonight, Michael, if you could just get us 5 million masks and send them to Colorado, we can distribute them, but it makes no sense for us to be looking up the yellow pages in China to buy masks. And I said to them, I wish that were enough. I wish that would be enough. But as long as Colorado is going to have to compete with New York, is going to have to compete with New Jersey, or compete with Florida, or compete with Texas, it won't work. And it's not just the price, although that is shocking. And the fact that there are people gouging, at a moment like this is appalling. It's not just the price, it's the availability. The nurses and doctors in Denver, Colorado, or in any city in this country tonight should not be using one swab for a test that takes 2. They should not be wearing one mask all day long, with a mask that's designed to be worn just with one patient. Donald Trump said, the president said yesterday, he looked into this, and as a businessman, he was shocked at all the masks being thrown away. We ought to be able to sterilize the mask. There are important reasons why we have those rules: to protect our healthcare workers and so we don't spread disease. By the way, I said, look, does it solve your problem that the president has said we can use construction masks now in our healthcare facilities? And they said, we're grateful for the additional masks that we're getting, but it's not remotely helping fix the problem, the scale of the problem. And a lot of these masks actually aren't appropriate in a healthcare setting. They'll do anything. They're not looking their nose up on it. I had somebody say to me today, one of the people on the call said they'd gotten masks from fingernail salon. And that they had no idea what quality the masks were. There was Asian writing on the outside of the package. They don't know what it is, but those masks will be there when they've run out of all the other masks. That's what they're going to use. That is what we're using in the United States of America tonight. That's what we're telling the people we're asking to save our lives, to save our parents' lives. That's what we're saying. I'm sure the other senators have had the same experience that I've had, which is I've been in touch with companies all over my state that stand ready to help produce supplies and equipment. The president said yesterday one of the problems he had with this, one of the challenges that he had was you wouldn't have any idea where to begin. Don't know who makes ventilators. Maybe they made them a long time ago and they've forgotten how to do it, but surely he doesn't believe that we can't figure that out. That we couldn't figure that out in a split second, where the manufacturing capacity is in this country to do what needs to be done. But these companies have said to me that nobody in the administration has been in touch to tell them what to make, how much to make, or where it should go. And the truth is, and the truth needs to be understood. I say to my colleagues, thank you for your indulgence. I think this is a moment in time when we have to get this right, and we're getting it so wrong. The truth is, as much as we welcome all of the citizens and businesses who are stepping up on their own, it won't be enough. Hanes can't produce 3.5 billion masks. They are a great company. They are involved in cotton products, as the president said yesterday. They can't make 3.5 billion masks. They can't do it in the time we need it done. GM and Tesla can't manufacture 40,000 ventilators. The 2 million masks that the vice president trumpeted yesterday from Apple, we appreciate it. It's an infinitesimal amount. Sounds like a big number. That's why the president actually said yesterday, the reason I come out and read these big numbers is so you'll know that we're sending out lots of stuff he said that. And I think that gives a complete misimpression that somehow this is handled, or that we got it together. We are one nation under God for a reason, Mr. President, and that is to respond to a challenge just like this one. It cannot be one hospital at a time, one state at a time, or one business at a time. That won't work. It's not a strategy. In fact, it's making matters worse. Because not only are we not fixing the supply chain, but the pricing is getting completely distorted, and people are competing with an incredibly scarce amount of goods. This is not a substitute, Mr. President, for a coherent national strategy to figure out how we're going to meet these critical supply and equipment shortages across the country. And every single day it gets worse. You can hear the panic in the governors and in the people working in our hospitals, and in the people that are working with people who are having to go in under unsafe conditions, willing to do it. On the front line of this war, with no ammunition. And as much as the president may not want to make these hard decisions, for whatever reason, because he hopes for the best, because maybe the medical thing will work itself out. Maybe instead of 18 months, it'll be shorter for a vaccine. Maybe the hot weather will make things better. He's literally the only one with the authority to call America to this challenge. The president is portraying himself as a wartime president, but he's leaving it up to Haynes to plan D-Day. It won't work. He needs to give the front line of this war the ammunition they need, and he's the only one who can do it. No one else can do it. This Senate can't do it. So there's been a lot of back and forth today about, a brief delay in passing this economic package. And as I said, I hope very much it will pass. I hope very much we'll have a deal soon. I hope very much it will be bipartisan. We should do our work, and we should get that done. But I beg you, my colleagues in the United States Senate, every member of this body should be calling on the White House and asking why, after weeks, months, there is still no plan to make sure our doctors and nurses have the gear to protect themselves. Why our hospitals still don't have the ventilators they need to treat people, and why it's not obvious where those ventilators are going to come from. Why we still don't have a clear strategy from this administration to arm the front line that is waging this war while we're here tonight. This is perhaps the greatest challenge our country has faced since the Second World War. It probably is, and it is scary. But we've risen to the challenges before, and I think we can rise to this one. I may not have voted for the president. I may not agree with much of what he does, but I urge him to act. I urge him to use the authority that's granted to him uniquely in America. Out of 330 million Americans, only the President of the United States has that authority. He won that election. He has that authority. We can't do it without him. Lives are literally at stake in Colorado and across the country. We need him to lead, and I beg every single member of this chamber to do whatever you can, if you have influence on him. You get him to understand the gravity of the situation we're facing, the scale of the situation that we're facing, the scope that we're facing, and the lack of preparedness that needs to be addressed by invoking his authority under that statute. With that, Mr. President, I thank my colleagues for their patience, their indulgence, and I yield the floor.
Mr. President.
The Minority Leader.
Thank you, Mr. President. I thank my colleague for his impassioned words that were right on the money. Now, Mr. President, the Senate is going to adjourn shortly, but that doesn't mean negotiations are slowing down one bit. Secretary Mnuchin just left my office. We've had some very good discussions, and in fact, the list of outstanding issues has narrowed significantly. We are going to work on into the night. I yield the floor.
Senator from Virginia.
Mr. President, I rise. I had not intended to speak today, but in my office, as I was alternately talking to Virginians and talking to colleagues about our goal to find an economic package that will backstop workers in the American economy, I had the TV on and I was watching what was happening on the floor. And I decided I would come and just speak for a few minutes because I frankly think that what's been happening on the floor today is sort of artificial, and it doesn't really show to the American public what is truly going on. There were a lot of speeches that were taking place where it was sort of a blame game, and I don't think that's what Americans wanted to see today. There was a vote just as yesterday, another vote today that failed, a vote that was destined to fail, and I don't think that's what Americans deserve to see today. What Americans didn't see yesterday and today is the intense dialogue and debate and discussion around the third coronavirus response bill, by far the largest. It is important to get the details right. We spent time to get the details right in a bipartisan way to pass an $8 billion supplemental appropriation just 2 weeks ago. We spent time to get the details right to pass an extension of paid child care and unemployment insurance that had a cost of about $100 billion. We are now talking about an economic stimulus package that could be as high as $2 trillion. The American public wants us to get the details right. As I look at the stimulus discussions, it's sort of 5 pillars, is the way I describe it to Virginians. It's workers and their families, it's small businesses, it's large businesses and industry sectors, it's state and local governments, and it's our healthcare network. Workers, we're all hearing from people in our states who were so significantly affected. They're without salary and wages. How are they going to pay their rent or their mortgage? They're in danger of eviction and foreclosure. How are they going to pay child care and other expenses? This has to be the heart of this bill. I think the White House accepts that, and we should too. This package has got to be right for working people, and the details matter. Only about 26% of American workers are covered by the unemployment insurance system. So we can't just rely on that old system if we really want to backstop all the people who've lost income and protect them and their families. I saw that the government of the United Kingdom over the week has decided to just make a guarantee to all working people. We will backstop you for 80% of your lost earnings during the time period of this national emergency. We should hold ourselves to that standard and try to provide a package that backstops workers and their families, those who were low and middle income. That's pillar one. Pillar two, small businesses. I think there's huge agreement on this. Small businesses are the engine of the American economy, the employer of first resort for Americans, but those small businesses, including nonprofit, cultural, and service organizations, have significant challenges, and we need to get them through this tough time. If we get them through the tough time primarily with loans, and then we come out of this public health challenge into a challenged economy and they just have more debt on their books, we're not really going to help them. And so the small business pillar of this is very important to get them through this challenging time and do it in a way that does not just saddle these small businesses with more debt. Third, large businesses and industry sector, of course we need to provide protection for them. That's not the issue. And frankly, the issue is not even really the amount of the protection that must be provided. It must be significant. However, we learned through the stimulus package in 2009 and through the tax bill in 2017 that dollars given to many of the large businesses without conditions can be spent in very economically unproductive ways. So it's important to get those details right. Limits on using these federal funds for executive compensation, limits on using the funds for stock buybacks. We can get the details right so that the dollars that are provided to our large industry sectors and businesses are used to protect their employees. States and local governments, we're all on the phone with our governors and with our mayors and with county health officials. We've all watched them close down school systems, close down universities, deal with extra healthcare challenges, deal with skyrocketing unemployment insurance applications in every jurisdiction in the country. We should provide them resources to deal with those challenges. And my hope as a former governor, and we've got other former governors in the chambers, when we provide assistance to state and local governments, we'll do it in a way with maximum flexibility so they can use those funds in the way they see fit to meet the local needs that they've experienced. The last pillar, and I'll close here, and this is to continue my colleague from Colorado's passion and plea on behalf of our healthcare industry. The last pillar is the key important one, and that is the appropriate level of resources to our healthcare infrastructure. There won't be any amount of economic stimulus that'll work if we don't handle the public health crisis in a very smart way going forward. Nothing we could do. We could make it $3 trillion. We could make it $4 trillion. we would be pouring the money away if we do not get the public health crisis right. And if we get it right, that will be the single most important thing to restarting the economy. And so the last pillar of the 5 pillars that we're spending time on is support for hospitals and community health centers and other health clinics and healthcare professionals, and also supporting childcare for them. We've got to keep our frontline healthcare workers at work, but many of them have children in schools that have now been closed. We don't want them having to stay home with their kids because there's no childcare when we want them at hospitals and clinics. And so part of that 5th pillar has to be to protect these healthcare workers, not only their physical health, but their ability to go to work every day. I believe we are close on the negotiation. I don't like watching stem-winding speeches from the floor blaming who's responsible for not being able to pass a vote, when I know 20 yards away, the White House is sitting down with Democrats and we're getting closer and closer and closer to come up with a package that can gain bipartisan acceptance, as it should. The American public needs action. The American public needs big action. But if we're going to spend $2 trillion and we spend it the wrong way, we will regret it for years. If we spend it the right way, we can get through this crisis in a way that will do minimum damage to our economy. And with that, Mr. President, I yield the floor.
Mr. President.
Senator from South Dakota.
Thank you, Mr. President. First, let me say thank you to my colleague, the former governor of Virginia and senator from Virginia now. As a former governor, we have a real interest in making sure that there is a good cooperative spirit between the federal government and state governments. But this evening, as we've gone through an entire day, which is rather unusual in the Senate to have one senator speaking after another with others here, at a time in which we should be exercising separation, as they say, to have had as many colleagues on the floor shows just how serious the United States Senate is taking this issue. Perhaps the frustration laid out by members of my conference is that we really want this to move forward as quickly as possible, and we understand that it's very difficult to put together the resources in order to buy those additional pieces of equipment that our friend from Colorado laid out, unless we have a long-term plan here in which to also pay for it. So what I'd like to do is to share a little bit within this, just in terms of a summary of what's in the proposal right now, and that we believe is an appropriate major step in taking care of funding to respond to not just the medical emergency, but also the economic emergency that we have in front of us right now for men and women that are worried about where they're going to get the next paycheck. First of all, under the appropriations section, we have $75 billion for hospitals. That's included in the proposal. $20 billion additional for veterans' health that's included. $11 billion more for vaccines, therapeutics, diagnostics, and other preparedness needs. There's an additional $4.5 billion for the CDC, the Center for Communicable Diseases, or CDC. And the reason why we've put that in there is because we want to be ahead of the game when it comes to making sure they have the resources to take care of the emergency needs that we know are showing up right now. There's also an additional $1.7 billion to add new medical equipment to the Strategic National Stockpile. As my colleague from Colorado was suggesting, this is an area where we need to beef it up, and we need to be able to provide that additional equipment. That's included in this bill that right now has been here for 2 days. Also, we understand that at the state level, there are other needs as well. There's $20 billion in here for public transportation emergency relief. There's $10 billion built into the bill right now for block grants to the states. That's the broadest type of resources that we provide to the states today. And there's an additional $5 billion to be added to FEMA's Disaster Relief Fund. Remember that FEMA is now at a level 1, which is basically their highest level. They're coordinating now on a 24-hour basis with every single state in the nation, directly, back and forth, to provide an avenue of communication and logistics so that when parts are found or equipment is found in one area, it can be coordinated to get to an area where it is needed. Not so much because we always have all the supplies that we need available right now, but because we want the supplies that we do have to get to where it is needed as quickly as possible. That is in operation today. Now, there are other pieces to this that are also really important, and one of the reasons why you've seen the frustration on the Republican side of this discussion is because there's men and women right now that don't have a paycheck coming in. They've been laid off. Through no fault of their own, they're being laid off because of COVID-19 and because their businesses have been asked, or in some cases directed, to close. And when that happens, we feel an obligation to try to at least allow them the opportunity to make it through the next few months to get ready for the recovery that we're convinced can happen if we properly manage the emergency before us. I'd like to just go through them briefly so that after an entire day of discussion, there's at least an understanding of what's in the bill today, just for men and women that are hurting today. On a per-person basis, we're offering about $250 billion in additional resources. For a child, there's $500 for every child in a family, but that's on top of $1,200 for a mother and a father. And what we're suggesting with that is that it doesn't mean that you've got to have made that much. This is a refundable tax credit, and it's available to individuals regardless of if they even made that much or paid taxes on that in the last couple of years. This is really important because this is an immediate upfront payment from the Internal Revenue Service, the IRS, back to individuals. And the sooner we pass this legislation, the sooner those dollars can get out to people who right now are hurting, and they need this additional assistance at this time. Not a month and a half or 2 months from now, but as soon as we can get it to them. Additionally, we have an unemployment proposal that increases the amount of money that goes into the unemployment funds in the amount of about $250 billion as well. Now, how does that break out and what does it mean to an individual? If an individual is on unemployment today, what we're offering, besides what they're getting from the state, is first of all, first dollar coverage with no 1 week wait period. And second of all, we're adding an additional $600 per week for the first 9 weeks that they're eligible for. Now, that doesn't mean that unemployment stops at that point, but there's $600 additional during that 9-week period of time. This is very important for individuals that have no place else to go and have already been laid off of work because we've told those businesses that they have to shut down. Now, another piece of this product right now that I think is an excellent piece, and one that I think not only offers emotional support for men and women that are struggling, but it also shares through small businesses an amount, about $350 billion, that goes to small businesses, businesses that are under 500 employees in size. And when we define an employee, we're talking about an FTE, or full-time equivalent of 40 hours. So if you've got 2 half-times, you have 1 FTE. But what we've offered to small businesses in this is a very simple loan and loan forgiveness program that they can go down to their local lender and apply. And the local lender is the person that puts the papers together and so forth. But what it allows them to do is to go down and say, look, I just have been told that my business is shut down. I don't want to lose my employees. And what they can do is borrow the money to continue to pay the payroll and benefits for those individuals that they would be laying off otherwise. And if they keep them on for a period of up to 8 weeks, we forgive the loan. It becomes a grant. But the reason for that is if we don't do that, those same individuals are going to be on the unemployment rolls. So why make them go through that emotional distress? And why have it in such a position that they may not get the benefits back that the small business is offering today? But we've done something else as well. We've said for that small business owner, we know many of you have mortgages, you have ongoing payments, so we'll also let you include your mortgage payments as well, and your ongoing rent, lights, and so forth. And if you keep open, you can also apply to have that part forgiven as well, up to a grand total of $10 million per business. Why? Because we want stability in the marketplace, and we think that's what a lot of employees want. We'd like to have that out this week. That's one of the reasons why you see the frustrations and the irritations on the Republican side of the aisle here, because we really thought that these items that we thought we were negotiating in good faith with members of the other side, with working groups that had both included, in such a fashion that we could move through this fairly quickly. And in fact, I think you've heard members on the other side of the aisle talk about the fact that they're not disagreeing with those things. Now, there's another part, too. There's larger businesses, over 500 in size. When we have businesses that are bigger than 500 in size, what we said is, look, we're not going to give you a grant program. We're not going to be in the position of bailing you out. But what we do want to do is to make liquidity and loans available to you, loans that you can afford. We're going to ask some conditions of that, yes. But the idea here is to allow them to survive and to be ready to go back into business. Now, this seems to be the place where we have the most dissension and disagreement among the two parties, because while we are proposing that they can't use this to buy stock back, I think some of our Democrat colleagues thought we had to strengthen it. Fine. That shouldn't take 2 days to work out. They think we should have some more guidelines. Fine. But that shouldn't take 2 days to work out. The goal here is to keep as many people employed and to keep those businesses operational so that as we move through this health emergency, that those businesses continue to do business in the future. There's a larger portion in this, which we also talk about, which is for the airlines and so forth. We have a frustration as well with our Democrat colleagues because of some of the suggestions that have been made. We don't think that they should have to remake their board of directors if they're going to get a loan. We think that the airlines are critical, not just to save the airlines, but because business relies on airlines and people rely on airlines now to get from one place to another throughout the United States. We've also included about $17 billion to take care of those separate industries on which we have national defense-specific issues. We think this has been well thought out. It doesn't mean that there isn't room for more negotiations, but time is of the essence. As we sit here this evening, more people will die, more people will get sick, more men and women will find themselves wondering where they're going to get their next paycheck. Every single day matters. So our request to the members on the other side of the aisle who have twice now said, no, we don't want to take the first procedural step to get onto the bill. What we say is look, you've got to push hard on your leadership to come to a consensus. And please, this is emergency legislation. This should not be a Christmas tree. It should not be a piece of legislation that, since it needs to pass, that we can now put a wish list of other things that one party or the other has been trying to get in law, but does not have consensus on. This is where the areas of contention are this evening. So, to the men and women that are out there that are concerned, I can share with you that I think we have a very good plan, one that will come close to $1.9 trillion in terms of what we are offering. But at the same time, it needs to get out as quickly as possible, and it's got to be as simple as possible for those men and women to be able to apply for in an unemployment line, or the businesses to apply at their local bank so that they can keep people employed, or for that larger business to understand that liquidity is available to get them through a very difficult time, but it's not going to be a grant. It's going to be a loan. And finally, an area which is important that perhaps can have some additional thought put into, and that is that not just the hospitals at the local level need our support and our assistance right now because they can't do this by themselves. But we're going to find state after state is going to be knocking on our door saying, you've shut down businesses in our state, you've told us that we need to in order to quell this emergency. But in doing so, the revenues that are generated because of those business activities we don't have. And so you're going to find state revenues that are down significantly. They're going to be coming in, they're going to be visiting. I'm convinced that between this package and perhaps the next package, we have to also recognize the impact to state governments who provide so many of the services that men and women rely on a daily basis. So I'd like to thank you for your time, Mr. President. I think this is important, and I think the message that we have to have as responsible individuals members of this body in which today we truly did have debate and discussion on the floor. We have to finish this, and we have to do it in such a fashion that it reaches men and women who are counting on us as soon as possible. Thank you, Mr. President. I yield the floor. Mr. President.
Senator from South Dakota.
Thank you, Mr. President. I ask unanimous consent that the Senate proceed to executive session for the consideration of Executive Calendar 632, that the nomination be confirmed, the motions to reconsider be considered made and laid upon the table with no intervening action or debate. The President be immediately notified of the Senate's action.
Without objection.
Mr. President, I ask unanimous consent that the Senate proceed to the en bloc consideration of the following nominations: Executive Calendar 238, 451, 453, 571, and 630.
Without objection, the Senate will proceed to the nominations en bloc.
Mr. President, I ask consent that the Senate vote on the nominations en bloc with no intervening action or debate, that if confirmed, the motions to reconsider be considered made and laid upon the table en bloc. The President be immediately notified of the Senate's action.
Without objection. The questions on the nominations are en bloc. All members say aye.
Aye.
All opposed, no. The ayes appear to have it. The ayes do have it. The nominations are confirmed en bloc.
Mr. President, I ask unanimous consent that the further, that following the prayer and pledge, the morning hour be deemed expired, the journal of proceedings be approved to date, the time for the two leaders be reserved for their use later in the day, and morning business be closed. Further, following leader remarks, the Senate resume consideration of the motion to proceed to H.R. 748.
Without objection.
Mr. President, if there is no further business to come before the Senate, I ask that it stand adjourned under the previous order.
The Senate stands adjourned to 10 a.m. tomorrow.